Hello, I'm Dr. Robert LaLouche, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk a little bit about a hysteroscopy D&C. Hysteroscopy, dilatation and curettage, is a very common procedure. We do it where women with abnormal bleeding. We do it for women with postmenopausal bleeding. If you have very heavy periods, you might do that linked with a novosure ablation or an endometrial thermal ablation. There are separate videos on postmenopausal bleeding. There's separate videos on heavy bleeding and the novosure ablation, but I thought I'd just focus in on the actual what to expect for the procedure and post-operatively what to expect if you get a hysteroscopy D&C. It's a very minor surgery, usually in surgery centers, outpatient. Very simple, doesn't take too long. The risks are minor. You should talk to your physician about your particular risks, but in general, all surgeries have risk of bleeding. Usually the purpose we're doing this is to help ameliorate bleeding problems, but you might bleed from this procedure, and if you bleed enough, you might need a blood transfusion. Never had to do that for this procedure, but it's very low risk, and if you do need it, the blood is very well screened, one in quite low risk of getting HIV or hepatitis. Those statistics change, so I didn't give a specific one, but years ago it was 1 in 2 million and 1 in a million for hepatitis and HIV respectively. But those risks are minor, and like I said, I've never had to transfuse after a hysteroscopy D&C. There's a risk of the anesthetic, and depending on your age and your other health factors and whether or not you smoke, then that can be one of the highest risks, but overall still very low risk, and you wouldn't have this procedure done if that risk was too high, but never can get risk down to zero. There's also a risk of infection. The chances are so low we don't even give preventative antibiotics, but that would be something to watch for post-operatively. So when we do the actual procedure, you're asleep. Depending on what we're looking for, whether you have a fibroid or a polyp inside that can extend the length of the case or just postmenopausal bleeding, it's usually minutes, maybe less than 5 minutes, less than 10 minutes. You have to find out from your physician, depending on what is being done. Then we'll look inside with a camera. It's a fiber optic camera, just like doing a pap smear with you asleep. We dilate the cervix, look inside. There's fluid that goes in that distends, opens up your uterus so we can see and get a better view. Then we'll do the D&C is dilatation and curettage. That's where we just scrape the lining of the uterus, send that to pathology. If you have a polyp, we would take it out with some polyp forceps, or sometimes we need an instrument, some highly specialized instruments that kind of carve down a growth or fibroid or polyp to remove it. That would extend the time of the surgery, and usually we know beforehand if that's a possibility for you, and your physician would let you know about that. Okay. Once you have the procedure afterwards, most women report minor cramping. Usually don't have to give much pain medicine. Sometimes ibuprofen, Advil leave, and it's as if you were on your period. If you have an ablation, then the bleeding is the burned lining, so the discharge will look darker and different. And you might also have a little longer bleeding than average if you're on a blood thinner, which you would get if you have like a heart condition that puts you on a blood thinner if you have postmenopausal bleeding. There are circumstances, you need to hear the tailored answer for you, but where you might have a little more bleeding, might be a couple of hours, might be a few days, even a couple of weeks. You should have a clear understanding of what to expect before you leave your surgery center or your hospital. And whenever you're in doubt, that's what a phone call for, and contact your staff, your support team, and make sure what's occurring is within the normal expected range for you. You shouldn't have any fevers. You want to watch for those. A couple of days after, if you have some fevers, that might be an indication of an infection. You certainly want to call for that. After getting any anesthetic, we give you some fluids. A little bit of swelling is normal, but we don't want dramatic swelling, especially on one leg. That could be an indication of a blood clot. That's another risk. It's really rare, but something to notify us. You'll have a list of things to go over on what to watch for, and if you don't have that list, then it's not time to leave yet. You need to get that list from your provider to make sure that you have all the information on the things that you want to watch for your particular case. So overall, very useful procedure, and no major incisions, low risk overall, and can solve lots of problems like bleeding problems or bleeding after menopause. And so it's a rewarding surgery for us physicians because we can really do some good with it. So I hope you found this information of use. Please leave your comments. Thank you.